Hello and welcome to today's live webinar, Health Standard Organization, also known as HSO's National Long-Term Care Services Standard, a conversation with OARC. I see people are just starting to hop on to the meeting, so we'll just maybe pause one moment and let people get situated, and we'll kick things off in just a moment. My name is Melissa McVie, and I am the Director of Communications with the Ontario Association of Residents Councils, OARC for short. There we go, another acronym. And we are so pleased to be facilitating this afternoon's webinar, which will be featuring two very special guests, Emma Park and Devora Greenspon, who I will give a more formal introduction to very shortly. So I'm just looking at our numbers. I think people will be logging in as we get started, but thank you so much for joining us. Again, it's Melissa from the OARC team, and we are so pleased to be commencing this webinar today, HSO's National Long-Term Care Services Standard, a conversation with OARC. And before we get started, we wanted to express our gratitude and our appreciation by acknowledging the land we reside on. Together, let us now pause as we acknowledge the Indigenous peoples of all the lands that we are on today, from wherever we are virtually participating in today's meeting. Let us take a moment to acknowledge the importance of the land we each call home. We do this to affirm our commitment and responsibility to improving relationships between nations and to improving our own understanding of local Indigenous peoples and their cultures. We acknowledge the ancestral and unceded territory of all the Inuit, Métis, and First Nations people who call this nation home. Let us now join in a moment of reflection to acknowledge the harms and mistakes of the past, and to consider how each of us in our own way can move forward in a spirit of reconciliation and collaboration. Thank you. Now, we wanted to share a few housekeeping or logistic announcements before handing things over to our esteemed guests. And we're very pleased to share that this webinar today will feature a live French language interpreter. To access the interpretation, you must be connected to a computer audio. So unfortunately, this feature is not available to the telephone if you're using a telephone dial-in connection. So that's an important consideration. To take advantage and to utilize the interpretation feature, select the interpretation button, which is located on the Zoom toolbar, and it looks like a circle or a globe. There's a picture of it on the slide here for you. And be sure to choose French Canadian if you prefer to tune in French. You will hear the translated version as well as the original version at a lower volume so that you can hear tone and intonation. However, you can choose to mute the original version by clicking the interpretation button and choosing Mute Original Audio. Interpretation is only available during this live version or live session of the webinar, and unfortunately, it won't be available in the recorded version. We will be recording the English version of today's session, and it will be available to all participants through the OARC website and our YouTube page. We will also share it with all registrants by email following today's session. Now, we have protected lots of time for question and answers, as we know this is a topic people are really excited about and eager to dig into. So to streamline the question and answer part of our time together, we have we've disabled the chat box feature, and instead we'd like to direct you to the question and answer feature at the bottom of your toolbar to pose your questions. Now, The questions will be saved for the latter portion of our time together, but you're welcome, if a question pops in your head, you're welcome to put that in the Q&A box, and we'll go through those questions after our guests have finished their presentation. Now, we also wanted to, your feedback always helps us enhance our webinar offerings and delivery. So we do invite you to stay on at the end of today's session to give us some feedback. There will be a survey that will pop up on your screen. So I'll remind you of that at the end of our session. So now, without further ado, please join me in welcoming our very esteemed presenters. Emma Park is a project lead for the Health Standards Organization, HSO, and she led the development of a new national long-term care services standard, which we'll be hearing about today. And some of you might recognize the other smiling face on your screen, Devora Greenspon. Devora is a resident leader in her long-term care home, Extendicare Bayview in the Toronto area. She is also the co-chair of OARC's Resident Advisory Group, also known as the REAL Group. And Devora was a member of the technical committee that helped to develop the standard. A sincere thank you to both Emma and Devora for being here today, and we'll hand things over to you.
Thanks very much, Melissa, and thanks for having us. We're really honored to be here, and thank you everyone for joining us today to learn a bit more about this standard. My name is Emma, and I'm calling today from the unceded traditional lands of the Algonquin Anishinaabe territory. Next slide, please. So in terms of what we're going to talk about today, I'll start by giving a bit of background about our organization, Health Standards Organization, and standards in general. And then I'll speak about the long-term care services standard and how it was developed, give some information on what's actually in the standard, and then some next steps now that the standard is published. And as Melissa mentioned, we'll leave plenty of time at the end to answer your questions. Next slide, please. So who is Health Standards Organization? Health Standards Organization, also known as HSO, develops standards, assessment programs, and other tools to improve the quality of health services in Canada and globally. Now, standards exist in every aspect of Canadian life. They are the invisible infrastructure that lets us work and live safely, and they can become the basis of government legislation, policy, regulations, and accreditation as well. Now, while standards can become the basis of legislation, they are not the same thing as law. And in most regions of Canada, including in Ontario, long-term care homes do not need to be accredited in order to operate. Now, the development of each HSO standard is overseen by a technical committee. And as Melissa mentioned, Devora was a member of the committee that developed the long-term care services standard. Standards also go through a public review process in which members of the public can provide feedback. And I'll speak a bit more about how we develop standards in a moment. Next slide, please. So why did we develop a new national long-term care services standard? So the COVID-19 pandemic really highlighted the gaps and needs in Canada's long-term care system that had existed for a long time. So HSO submitted a proposal to the Standards Council of Canada, also known as SCC, which is a Crown corporation that promotes standardization in Canada. And we submitted this proposal to develop a new national long-term care services standard to address the delivery of safe, reliable, and high-quality long-term care services. SCC accepted this proposal, and they agreed to fund the development of this standard over 2021 to 2023. CSA Group, which is another standards development organization, just like HSO, developed a complementary standard to address the design, operation, and infection prevention and control practices in long-term care homes, and the CSA standard was released in December 2022, with the HSO standard released in January 2023. HSO and CSA worked very closely together during the development of these two standards to ensure that they were aligned. Next slide, please. So to provide a quick overview, this new long-term care services standard provides long-term care teams, leaders, and governing bodies with criteria and guidelines for delivering resident-centered, high-quality care that's enabled by a healthy and competent workforce. I'll be sharing a bit more about the content of the standard later on, but first I'd like to discuss how the standard was developed. Next slide, please. So the standard was developed over a 23-month timeline from March 2021 to January 2023, following the process set by the Standards Council of Canada for the development of standards. We started by establishing a technical committee. Then we conducted a literature review to make sure we had all the evidence. We developed a first draft of the standard and had a public review to receive feedback from the public on the draft standard. We then made changes to the standard based on that feedback before publishing the final standard in January 2023. So while this might seem like a long time, it's actually an expedited process. Standard development can take much longer, but it was very important that we do the work well, but also finish this standard so that it can make the change that we hope that it will make. Next slide, please. So the standard was informed and built from three main sort of areas. One is the clinical and technical expertise and the lived experience of our 32-member technical committee. Two is the input and feedback from over 18,800 Canadians. And three is the best available evidence. And I'll go into each one of these briefly. Next slide, please. So starting with our technical committee, HSO launched the call for applications for the technical committee in March 2021, and we received more than 250 applications from members of the public wanting to join our committee and help develop the standard. From those applications, we formed a 32-member committee that included representation from 11 provinces and territories, and representation from residents and essential care partners, the long-term care workforce, leadership, policymakers, and researchers. A quarter of our technical committee was made up of current residents of long-term care like Devora, or essential care partners, so people who have that lived experience of living in long-term care or having a loved one who lives in long-term care. Having this representation on the committee developing the standard was really, really essential to our work and to embedding the resident-centered care philosophy that we have at HSO throughout the whole standard. Next slide, please. Throughout the development of the standard, we also heard from over 18,800 Canadians who shared their experiences, perspectives, and feedback that informed the final content of this standard. And findings from this public engagement have been summarized in a three-part series of what we heard reports that are available on our website. Next slide, please. So here is a bit of an overview of the different public engagement activities that we conducted. So we included a national survey, individual and group consultation workbooks, 2 phases of town halls, a public review that I mentioned, and then virtual visits with residents. Throughout these public engagement activities, we heard from over 400 residents and more than 3,500 essential care partners. We were able to reach residents and essential care partners by collaborating with organizations representing residents such as OARC, as well as organizations representing family caregivers such as Family Caregivers of BC and Family Councils of Ontario, and also organizations that represented long-term care homes. We also had a lot of engagement from Ontario, specifically during this process. Over 9,500 people from Ontario participated. We heard a lot of feedback from the public, but one of the key areas that we heard was about improving the care experience, including going above and beyond just medical care, engaging residents and essential care partners, enhancing communication, ensuring the long-term care home exemplifies the quality of a home, and really recognizing resident autonomy and freedom of choice. We also heard a lot about the importance of recognizing the long-term care workforce and enabling good governance and leadership. And all of these things we heard, we really made sure were embedded into the final standard. Next slide, please. And then the final piece was evidence. So we wanted to make sure that the standard was based on the best and latest available evidence. It was a very important part of the process. We completed a preliminary literature review in 2021 to inform the drafting of the standard. And then later on, we commissioned 45 additional evidence reviews on a variety of topics to really make sure we had everything that was the latest to go into the standard. And findings from these evidence reviews were very instrumental in the development of the standard, particularly in the guidance that provides information to long-term care homes about how exactly they meet the requirements in the standard. Next slide, please. So 23 months of work went into developing this final standard, and the final standard provides long-term care home teams, leaders, and governing bodies with guidance on 4 main areas. The first is providing evidence-informed, resident-centered care that values compassion, respect, dignity, trust, and a meaningful quality of life for residents. The second is working in a team-based way to deliver high-quality care that is culturally safe and trauma-informed to meet residents' goals, needs, and preferences. And I want to be clear that in the standard, we define team as not just the staff of the home, but the team also includes students, volunteers, essential care partners. Residents themselves are part of the team. The third area is enabling a healthy and competent long-term care workforce and healthy and safe working conditions. And the final area is upholding strong governance practices and a culture that is outcome-focused and committed to continuous learning and quality improvement. Next slide, please. So these 4 areas are really brought to life in the 6 sections of the standard. So the standard starts with governing long-term care homes' strategies, activities, and outcomes, then upholding resident-centered care, enabling a meaningful quality of life for residents, ensuring high quality and safe care, enabling a healthy and competent workforce, and promoting quality improvement. And within each of these sections are requirements for long-term care homes based around these topics. And the next slide. So as I mentioned, the standard was released on January 31st, 2023, and it is available to the public at no fee for 5 years, so there's no cost to view the standard. We had an incredible positive response to the launch of the standard so far from the public and key stakeholders, including statements made by Prime Minister Trudeau, the Minister of Health, and the Minister of Seniors, welcoming our work and speaking about the positive impact that they feel it will have. So what are the next steps? The standard is going to be included in Accreditation Canada's Momentum Accreditation Program, which is currently being used on both a voluntary and mandatory basis to accredit 68% of Canada's long-term care homes. Given the standard is freely available, long-term care homes that are not accredited by Accreditation Canada, so the remaining 32%, are welcome to use the standard for their own quality improvement as well. You know, they can access it online and use the standard. In addition, if there are any other accrediting bodies other than Accreditation Canada that want to use the standard in their assessment program to accredit long-term care homes, they are welcome to reach out to us at HSO, and we're happy to work with them to see what the options are. So you might know that your home, for example, is accredited, but they're accredited with a different accreditation body, not Accreditation Canada, and we're very happy to work with any other organization to see what the possibilities are with the work that we've put so much into. There are also other ways to implement the new standard outside of accreditation, and we really look forward to engaging with all the relevant stakeholders to determine the best and most impactful ways to improve the health and well-being of long-term care residents and workers across Canada. So I know that was probably a lot of information, and now I really want to turn it over to Devora to share some of her experiences being on the committee that developed the standard. So Devora, I would love to hear from you.
Thank you, Emma. It's my pleasure to join you here this afternoon. I hope I can be of service and give you you're going to have to bear with me because my words don't come as quickly as they used to. So sometimes I speak more slowly. It was an honor and a privilege to be chosen to sit on this committee with such illustrious people from all over Canada. I was thrilled to be part of something that could change the living conditions of residents in long-term care. We discussed so many things and we went through so many standards until we got the one we wanted. What was very important in creating the standards was to make sure we had quality improvement, we had culture change, and we had care for all residents in long-term care. I was really impressed by all the knowledge that came from all the places in Canada. It was just wonderful to work with these people. They're all so bright and have such good ideas. And that was another thing I gleaned from being on the committee is information about what's going on in the rest of Canada. Because I think, as far as I can figure out, that Ontario is the only province that has a mandatory residence council. And through residence council and my being part of residence council and bringing forth questions from my own home. And what really impressed me too about the committee is that they asked my opinion. And to me, that was very important, that the residents' opinion had to be part of this change to develop the standards that would be used in all of Canada. Now, I know that every province is different and they all can't use the same standards, but I'm hoping, and this is my hope for the future, that these standards are used by different provinces and they can just glean what they need from the standards that would be applicable to their long-term care. And I hope with all my heart that that's what happens with these standards. And they're not just put on a shelf somewhere to gather dust. Do you want me to speak some more?
If you have anything more you want to say, go for it. But otherwise, whatever you'd like to.
No, this is my hope for the future, that these standards will be used by residents who come after me and need long-term care, because I didn't go into long-term care to die. I went into long-term care, and most people do go into long-term care because they have some sort of disability and they can't live at home anymore. So what's happened to me is I moved into long-term care. I changed addresses, but I'm the same person. My personality or my wants and needs didn't change when I moved into long-term care. And it's so important in long-term care to have person-centered care. I just moved in because I couldn't walk, but I still wanted to dance and laugh and have fun and go places and do things. I didn't want to just sit in my room and look at the four walls. That's no way to live. So I'm really glad that I sat on this committee. As I said before, I got a lot of information that was interesting and that I could use with my residents. And I really feel it was a fantastic experience and a privilege to sit with all the people on this committee. And I want to thank all these people who worked so hard to make life better for residents in long-term care. Thank you.
Thank you so much, Devora. That was very, very impactful. And I want to say it was a privilege for us to have you on the committee as well, and to hear what you had to say, and all the other residents. That was such an important part of the development of this standard for us and all of our standards is to make sure that the people who are ultimately impacted by the work that we do are very involved, and that we hear from them. Thank you so much. Okay, I think we can move on to, I think we have a poll question before we get into the question and answers. So we just wanted to ask a quick poll question just to gauge some information. So the question is your long-term care home accredited by Accreditation Canada? Yes, no, or not sure. So it should appear on the screen. Okay, it should be on your screen now. So you can just select the response, and there is a not sure option if you don't know, and we'll leave that up there for a little bit.
I think the responses are still trickling in, but it seems to have slowed momentarily. So maybe we'll give it one more moment, Emma, and then we'll share the results.
Sounds good.
I was also thinking, for those who might be unsure, this would be a great question or topic to explore with your home's residents council. Often residents are involved through the accreditation process. But if you're not sure, perhaps it could be an opportunity to have an invited guest from your home's leadership team to delve into this topic of accreditation and the national standards. So can you see the results on the screen, Emma?
Yes, I can see the results. So it's looking like majority have said yes, and then a smaller amount said no, and there are quite a few who aren't sure as well.
Okay.
I'm sorry to interrupt. I lost interpretation rights.
We'll work with you, Sophia, to get that restored. I apologize. I'm not sure what's transpired on that end.
Thank you.
Okay, so hopefully we can get the French translation or the real-time interpretation back up and running. I do apologize for that technical difficulty. But this brings us to the question and answer portion of our time with Emma and Devora. And I know we were so thrilled to receive, I'll throw my camera back on here. We were so thrilled to receive lots of questions in advance of today's session through your registrations. And so Devora has kindly offered to take turns with me so we can pose some of the advanced questions and alternate between the questions that are coming in real time through the question and answer box. So again, for those who might have questions about what you've just heard from Devora and Emma, please take advantage of our question and answer box process through your Zoom toolbar. And perhaps I can kick off with the first question that's coming from North Renfrew. And the question is, where can we get or how can we access the national standards that we've just heard about?
Yes, so the standard is available on our website. I don't know, I think the link was in the description for the webinar, but also Melissa, could it be sent out afterwards?
Yeah, we can send it with the recording. Yeah, we can certainly send it with the recording of today's webinar to all registrants. And it's a download. It's still a free download in French or English?
Yep. So you do have to go to our online store, but it's $0. And it'll be a download in French or English as a PDF.
Great. And the registration step is simply so for tracking, right? So people, the team know how frequently it is being accessed by the public.
Yes, exactly. And most of our standards do usually cost some money, so it's just kind of the same format, but it is $0 and it requires no fee.
Wonderful. Thanks, Emma. Devora, perhaps I can invite you to segue into our next question.
This is the one to read. Okay, I will ask the next question that was submitted to us before the webinar. The question is, what efforts can be made to make the standard mandatory?
That is a great question. So standards work through accreditation, and whether or not accreditation is mandatory for long-term care homes is a decision made by individual provinces and territories. Health Standards Organization is a non-governmental organization, so that's not something that we are able to control. Accreditation for long-term care homes is currently voluntary in most provinces and territories, including in Ontario. So making standards mandatory is really a question to go through provincial or territorial government.
Great, thank you for that explanation. Hopefully that answers that question that came in. Thank you. There was a question regarding some clarification. Is CARF the same as Accreditation Canada? Are they the same? I think you alluded that they were different bodies, Emma, but perhaps you could speak to that with a bit more detail.
Yeah, that's a great question. So these are separate organizations. CARF is another organization that does accredit long-term care homes in Ontario. So it's very possible that some in attendance are accredited by CARF. They're a US-based organization versus we are a Canadian-based organization, but they are completely separate.
Excellent. Thank you for that. And again, bringing it back to your resident council, if your home is maybe chosen to be accredited by one organization over the other, perhaps that could be a dialogue about kind of the rationale. And sometimes the accreditation is initiated at your head office or your corporate level, if you're part of a bigger organization, or perhaps it was a home level decision. So again, great questions to bring back to have some lively conversation at your home through your residence council. Devora, can we call on you again? Thank you.
Yeah, here's another question. Why did HSO choose to emphasize workforce mental health and workforce and mental health and well-being in the new long-term care standards?
I love this question. It's something that we're very, very passionate about. We really believe strongly, in the words of one of our committee members, Pat Armstrong, the conditions of work in a long-term care home are the conditions of care. So improving the mental health and well-being of the workforce is essential to improving the quality of care that residents receive. When staff feel valued, when they feel supported and heard, when they're compensated appropriately, when they feel physically and psychologically safe at work, they're much better positioned to provide the high quality care that residents deserve. So really, while it might seem like maybe why are we focusing on the workforce? We have a whole section of the standard on the workforce. It all comes back to what do residents deserve? What kind of care do they need? And what can we do to make sure residents receive that care?
I just wanted to say that you can't paint all residents with the same brush. We're all different. So therefore, we definitely need different standards of care.
Thank you.
Thanks, Devora. And I'm glad you did speak on that mental health theme, because I know in hearing from residents through OARC, residents are always thinking of their supportive team members and their welfare. They really do become like a second family to residents, so they really do care about, you know, putting that oxygen mask on first. So take care of your team, and that does translate to enhanced care and personal and social experiences with team members and residents too, which is so important. We have another question that's come through. Now, I'm not sure if you'll be able to speak to this one, Emma, but this person is an anonymous, posing this question anonymously, and they say, it was a surprise to learn that the organization pays for the Accreditation Canada process. Does Accreditation Canada have to pay to use the HSO standards? Is the question.
Yeah, good question. So yes, organizations, whether long-term care homes, hospitals, any other organizations, do need to pay to be accredited by Accreditation Canada, as we are a non-governmental organization. Accreditation Canada and HSO are sister organizations. In terms of does Accreditation Canada pay to use HSO standards, it doesn't really sort of operate like that. We develop standards. HSO is the arm that develops the standards and other tools, and then we pass them on to Accreditation Canada for kind of the implementation side. That's our relationship.
Thank you. That's helpful to know. Thank you. I hope that answers your question. Devora, do you have another question that we could pose?
Yeah. What are the consequences to a long-term care home for not meeting the HSO standard?
Yes, so it's really going to depend if they're accredited by Accreditation Canada or not. So a long-term care home that is accredited through Accreditation Canada's Q-Mentum program will need to meet all the requirements in the new standard in order to be accredited. But it's really, we want to work with homes to support them in what they need to meet the standard. And it'll be a process over a period of time to help long-term care homes meet the requirements.
Thanks so much. Devora, do you have another one? Our chat boxes or our Q&A box is slowing down a little bit, the live questions.
I do. What new funding will be made available to support the standards?
Yes, so I know, yes, funding is at the top of a lot of people's minds. There have been some announcements by federal, provincial, territorial governments about new funding to support improvements in long-term care generally, but a lot of those details are still to be determined. In Ontario, for example, they have announced funding to help long-term care homes reach an average of 4 hours of daily direct care per resident. And that is also something that is listed in the new standard, is 4 hours of direct care per resident. So there's lots of sort of complementary funding that's being announced, but lots of sort of agreements still to be made and those sorts of things as far as I'm aware.
Excellent. I'm gonna volley back to you, Devora. Do you have any other questions?
Yeah. What educational opportunities will be available for staff, and who, when, and where will the training take place?
Yeah, so if we're speaking about education for staff about the requirements of the new standard, that will mostly be part of the work that Accreditation Canada is going to do, as I mentioned, to help long-term care homes transition to the new long-term care services standard. But as I mentioned, the standard is freely available. So any home is welcome to take the standard and use that to educate their staff on best practices in terms of resident-centered care and those types of things. But there definitely will be resources in place when Accreditation Canada begins using the standard to accredit long-term care homes as well.
Thank you, Emma. Another question came in, and I think it's just a point of clarification that you did touch on earlier, but I think it warrants some repetition, maybe just to clarify for those who missed it earlier. So this anonymous person is posing the question or saying, so just to clarify, CARF is not using the new standards. Is it only Accreditation Canada adhering to the standards or embracing the standards at this time? Is there a plan, if CARF is not currently using the standard, is there a plan to eventually integrate them? Now, I know that might be outside of your scope, Emma, but perhaps you could maybe share some of the messaging from earlier.
Yeah, I could answer it a little bit. So CARF does not use standards developed by HSO. They use their own materials. All HSO standards go to Accreditation Canada if they're being used for accreditation, and that's what Accreditation Canada uses for their program. As I mentioned, we do welcome other accrediting bodies like CARF to reach out to us if they're interested in assessing long-term care homes against our new standard, and we're happy to work with them. As of now, I don't believe there's a plan, but we are very open. We are very open to that.
Okay, we have one more question that's come for the chat, and then I'm going to invite, I think, Devora to have the last question. How do the HSO long-term care standards fit into the development of the Safe Long-Term Care Act proposed by the federal government?
That is a good question. I don't really have a concrete answer on that, as I believe the Safe Long-Term Care Act is still kind of in a preliminary discussions, kind of a preliminary phase. But the federal government is definitely aware of the standard that we have created. As I mentioned, we did have very welcoming statements from the Prime Minister, Minister of Health, and Minister of Seniors about it. So I think we're just going to have to see what kind of further announcements on the Safe Long-Term Care Act sort of look like, and how all these different pieces come together in the end. I think a lot of the work that's happening right now is very aligned. For example, that 4 hours of care that I mentioned. Yeah, we're very open to all conversations with government or other stakeholders as well about ways we can keep aligned on the work and stay consistent, and all work towards what's our ultimate goal, which is improving the experiences of residents.
Thanks so much, Emma.
Okay, so in the future, if I have any further questions, who can I contact?
Yes, so you can contact me. I think if we could also send out my email address in the email with the recording, and that way people will have that as well. And I'm happy to answer any questions.
That's
I believe
fantastic.
that the email would be helpful.
Yes.
That's
Yeah,
wonderful.
we'll definitely make sure that's shared. I love answering questions.
Thank you. Now, I think we've made our way through some of the advanced questions as well as the live questions. So it's been a lively 45 minutes together. Again, on behalf of OARC, thank you so much, Emma, for your willingness to bring this subject matter to our resident audience, and to Devora for being part of today's presentation, and for your work through the technical committee. OARC has been so thrilled to be part of the process of developing these standards, and we were consulted every step of the way, and many of our resident leaders were involved in providing some of the feedback in the early stages. So we're just so grateful for this opportunity to have a little bit of clarification on the standards, and to really have a better appreciation for all the work that went in, and the high level of collaboration that did involve residents at the helm. I would say that was most important, to have resident voice infused, as long-term care exists because of residents.
Right. If not for us, none of you would be here, right?
Yes. So thank you so much. And as I mentioned earlier, when today's webinar concludes, you will be prompted to complete a brief evaluation survey. Your feedback and suggestions are greatly appreciated. And as I said earlier, they do help us improve our planning of future webinars. Thank you so much to Sophia, our simultaneous and interpreter. And we look forward to sharing the recording, and please feel free to bring this back to residents who might have missed today's session, and be sure to perhaps add this as a possible discussion topic at a future resident council meeting. So thanks again, everyone. Have a lovely afternoon. Take good care and stay in touch.
Thanks, everyone.